Okay, my iPhone says 2 p.m. So I want to be respectful of everybody's time. Welcome. It's April 20th, Monday. This is a briefing with Brooke, and this is one of the webinars that I'm doing to help provide resources to all of you and all of my constituents on dealing with the COVID crisis in Maryland. So I'm so pleased today to have a number of really excellent speakers who really know what's going on and know how to find the resources and know what the city is planning and what's being done to help support our seniors in Baltimore and some around the state as well. So I'm Brooke Learman, a state delegate for District 46, and that I'm proud to represent with my teammates, Senator Bill Ferguson and delegates Robin Lewis and Luke Clippinger. And although, of course, we represent District 46 in Baltimore City, we work around the city and around the state to do what we need to do to make sure that Maryland is dealing in the best way it can with the public health crisis and economic crisis that we are all surviving through right now. So I hope everybody had a good weekend. We went biking and hiking this weekend, which was nice. And I'm looking forward to warmer weather when I don't have to wear quite so many layers. But before we begin, I just want to make a few points about where we are today and why I host these webinars. So I have long believed that being a delegate is really more than about passing legislation in Annapolis. It's also about being a connector and being an advocate in between sessions as well, and providing information to you, to my constituents, to anybody who wants to listen or who needs help to make sure that we are decreasing barriers and increasing opportunity and keeping people safe. So that is one of the reasons that I'm so pleased to be able today, this webinar on seniors and how we can support our seniors, because we know that our senior communities are being hit very hard because of this crisis. As numbers of those affected by the worldwide pandemic escalate, one thing is absolutely clear, and that is that no matter where they live, our elderly residents face the highest risk. The brunt of COVID-19 is being borne by the poor, our poorest and under-resourced citizens, the elderly, and the sick. And as our U.S. Surgeon General Vivek Murthy said, it's up to us to ensure that they are not left behind. And I think our senior patients need additional measures of care and protection, and COVID-19 really just exacerbates those needs. So family care providers need to be aware of the hazards of COVID-19 and aware of what they present to their loved ones and understand how to mitigate them. And older adults, of course, already may be experiencing significant social isolation, and this social distancing may only worsen complications from that seclusion. Reduced time with caregivers may also place older adults at risk because of missed opportunities to catch cognitive or general health decline. My mother is in an assisted living facility right now in Bethesda, and it is incredibly worrisome and painful to me and to my brothers to not be able to go see her and give her hugs. FaceTime can only do so much, but we are doing the best we can, and we're grateful to the people who are taking care of her and who are taking care of all of our seniors in facilities and home around the state. So without further ado, I really want to turn it over to our presenters. They have a lot of great information to share. Tammy Bresnahan is the Director of Advocacy for the AARP. She has over 25 years experience in Maryland state government, specifically in health and social services programs. She has an extensive background in caregiving, retirement security, including Social Security and Medicare. And personally, I've worked with for years, and she's such a great resource to all of us who are working in Annapolis, so I'm so pleased she could be here today. Thank you, Tammy. We'll also hear from Liz Briscoe, who's the coordinator of the affinity group at the Maryland Philanthropy Network on Aging. The Maryland Philanthropy Network, Liz will tell you a little bit more about, but it does a lot of really important work on making sure in different topics and areas that we are funding and working well together in this area. Liz has worked in human services and healthcare throughout her career, and she's also assisting with managing the BCHD Division of Aging and Care Services Maryland Access Point, a no wrong door point of entry for adults and their families to access support services. She was also previously the executive director of Action in Maturity, a Baltimore City senior center without walls for 11 years. We also have Rebecca Deneen. Thank you so much for joining us. She's the assistant commissioner at the City Health Department for the Bureau of Maternal and Child Health, and she leads the incredibly important and fabulous Be More for Healthy Babies initiative at the Baltimore City Health Department. Under this initiative, for those of you who don't know, this is one of the great success stories in Baltimore. The city's infant mortality rate has declined by 32%, and the disparity in rates between Black and white infants has declined by over 38%. And I've had the pleasure of knowing Rebecca because of some work that I've done at the state level on a program called Thrive by 3, where we're trying to support efforts to do what Be More for Healthy Babies does around the state and to expand the work that they do, because when we find things that work, we need to scale them up. So I am so pleased today to have Tammy, Liz, and Rebecca joining us. And I'm gonna flip the slides as we go along. And then we'll have time for some Q&A as well. If you have questions, feel free to share them in the chat and I'll read those at the end. So here we go. Tammy, I'll turn it over to you.
Hi, good afternoon. I'm Tammy Bresnahan with AARP Maryland. Many of you know that we have a national organization for AARP where you see it on television and they're selling or advertising things like vacations and the magazine and supplemental insurance, but we have an advocacy office in each of our 50 states. And in Maryland, I am the director of advocacy. We also have an outreach person or 2 outreach people. As you know, AARP is a nonprofit, nonpartisan member organization, and we promote the health and well-being of older Americans, and we've been doing so for over 60 years. In the face of the global pandemic, AARP is providing information and resources to help older adults care for themselves and or their elders. We want to thank Delegate Brooke for inviting us to participate. AARP has developed some resources to address the virus and to share, and so that she can share these with her constituents. But first, just let me tell you about what we did when the Congress was meeting, and most of this happened at the national level. AARP fought for the $1,200 direct payment authorization to individuals who were working, unable to work, or living on Social Security. And initially they wanted that payment to be $600, and we successfully advocated for the full $1,200 for people, especially on Social Security. We also fought to protect vulnerable seniors in nursing homes, and we're continuing to do so, as that is a hot spot right now in with the virus. We also are advocating for cost-free testing and the vaccines, which are critical to fighting this deadly pandemic. And more Americans want to age in place. And so we want to make sure that they're able to do that without feeling isolated. With that said, AARP has developed a few resources for their membership and others, because we have this saying at AARP, what we do for all. And so you can find our information, AARP coronavirus resource page. It provides updated information on the virus, expert advice on health, personal finance, pharmacy, and caregiving. And you can see the link that I've shared. And then the question and answer with experts. A lot of our members have tuned in on Thursdays at 1 p.m. And you don't necessarily have to have access to the internet or to a computer. You can also call in, and the public's invited. They'll have experts on there who give you some information, and you can understand what's happening in and around your community. And you can also tools to stay connected. If you're one person that likes to volunteer, the AARP communityconnections.org site brings volunteers together to support those people. And that includes maybe picking up groceries, providing financial assistance, or lending emotional support to your neighbors, because this is a difficult time. We also have, we've noticed an uptick in fraud and scams, and AARP.org /fraud watch is the most up-to-date scams around the virus. Sometimes people are trying to sell you a test. Some people want to say that this is the quicker way to get your stimulus check. So make sure that you check out aarp.org /fraud watch so that you can be connected. With that said, we have, we've on our webpage, aarp.org/Maryland, we've added resources from all across the state. There are things there for, you can witness the New York Philharmonic, doing a concert. You could also do exercises. You can do a cooking class. And so there's a lot of information and resources on our webpage as far as virtual experiences. So we really thank Delegate Brooke Learman for bringing us together. We're happy to be with the other folks on this call, and that maybe we can answer some questions for you as we move along in this Zoom call. Thank you.
Thank you. Now I think we're going to turn it over to Liz.
Well, good afternoon, and thank you, Representative Brooke Learman, for this opportunity to present on the role of private and public partnerships, particularly highlighting the nonprofit work in this COVID-19 response.
Absolutely.
So this slide just gives an overview of the Maryland Philanthropy Network, who plays a strong, committed role in maximizing the impact of philanthropic giving on community, particularly during the pandemic. They have coordinated and educated, organized many funding campaigns to address the evolving needs and demands of the pandemic. They also provide a voice of awareness and the impact of philanthropy. The next slide.
Yep.
Rebecca, my colleague, will be giving a much more extensive summary of the Baltimore City's food access strategy for vulnerable adults, but I just wanted to highlight the nonprofits who, without hesitation, are working nonstop to meet the increased demands for groceries and prepared meals. For many who are sheltering in place and have no family or friend support systems in place, Meals on Wheels, Civic Works, Franciscan Center, and Be More Food Community have provided a peace of mind with both prepared meals and groceries. Salvation Army will be providing meals to the thousands of residents who live in high-rise apartment communities. Many of those communities comprise a mixed population of non-elderly with disabilities, along with the older adults. Next slide.
Mm-hmm.
Another collaborative initiative, which has been in place for the last 3 years, but is so
which
key.
Is so great.
Yeah.
The hubs, it's fantastic.
Yeah, thanks. And I know the Banner, you know,
Mm-hmm.
Banner Neighborhoods is in your district, so they're one of the anchor institutions. Is to support older adults is the HUBS program, Housing Upgrades to Benefit Seniors. As you can see, there are many, many nonprofit collaborations here, along with Baltimore City Housing and Community Development, to provide the support to enable older adults to remain in their homes and age in the communities they love. The 5 anchor hub organizations are strategically located throughout Baltimore, providing assistance with receiving home repairs, weatherization, appliance upgrades, and reducing neighborhood blight. This successful project could not have happened without the generous funding by Hofberger, Stulman, and Weinberg Foundations. So we all work together for this success. Next slide. Many of the Baltimore Housing Authority buildings are now privately owned and managed through the RAD transfer. However, I wanted to highlight the and show the landscape of our nonprofit affordable housing partners. Catholic Charities, Comprehensive Housing Assistance, Bon Secours, CSI, all of them provide and incorporate a holistic approach to residential living, hiring service coordinators to provide wraparound services like transportation, eating together programs, senior center activities. Many provide even assisted living, adult day care that address the aging continuum. So that's, you can go to the next slide to show the other ones. St. Ambrose Housing Aid Center also has a home sharing component, and they give housing counseling for many people who are trying to transfer out of their homes and into rentals. The Maryland Consumer Rights Coalition offers a lot of fair housing advocacy over in the legislation, and the Public Justice Center helps a lot of folks with landlord tenant issues, particularly those who are being threatened by eviction. Next slide. I wanted to highlight our wonderful legal partners who work together to provide free legal services. That's the one above it. The slide before it, Brooke.
Oh, sorry.
Illegal.
I missed
Sorry.
it. There we go.
That's okay.
That's all right.
And they provide free legal services. A lot of times, sometimes it's just nice to talk to some kind, empathetic lawyer. For many people, this is the first time they've ever sought out legal advice for estate planning. They also help navigate and educate on the importance of having a will, an advance directive, medical and financial powers of attorney, and how to avoid probate. They can help with many civil matters too, particularly Maryland Legal Aid can help with expungement and issues like tax sales that many people face, sometimes unjustified. So the last slide I'd like to show and point out is you can flip to the next one, is a list of organizations who can help with economic security, which, as we all know, correlates to successful aging. All of them can help with subsidy applications like food stamps, water bill discounts, Medicare prescription subsidies, and homeowner renters tax credit. These organizations all have social workers there to, just lend a helping hand on any kind of issues that you might have and help you guide through it. Try to avoid, as Tammy mentioned, some of the scams that can occur in this venue and financial exploitation. And lastly, I want to thank all our partnerships, because we all know that this is the key to a successful pandemic response. So I'm going to hand it over the presentation to my colleague, Rebecca Deneen.
Hi, everyone. It's actually not April 14th, though I never know what day it really is. It's April 20th. But it's thank you very much, Delegate Learman and Senator Ferguson as well, for your support on Thrive by 3. Thanks for mentioning that. It's been really important for prenatal to 3 to have people really understand the importance of care coordination, and actually is something that we're using in terms of thinking for the strategy for the health department. So I'm actually on the other end of the age spectrum in my work on the COVID-19 response. While I'm still working in maternal and child health and running that bureau, our bureau is on a lesser level of response right now. And so I was pulled over to direct the strategy for the food response for seniors, for older adults. So I'll walk through kind of the thinking that we have around it. We do want to think about the full senior support citywide, which is about 144,000 seniors. So of those that are 60 and older in the city, there are about 144,000. And we think about people in the city in public health. We think about the public health pyramid. And what that means is we're hoping that people are primarily supported when you have really strong infrastructure by family and friends and the neighborhood organizations that are thriving and doing such a great job and have been described so well by Liz. And then as we start to get up the pyramid, you need more intense efforts that come from the public sector. And so senior living facilities and then our homebound older adults need special attention, and I'll describe what we're doing. Next slide, please. So for levels 1 and 2, as I said, this is really where we hope that, about 115,000 older adults will probably be supported by neighborhood organizations, families, and friends. And so how do we make sure that those seniors are supported and kept at home? Because we know that COVID-19, as has already been described, is particularly potently dangerous for older adults. So we want to make sure that as much as possible, older adults aren't out and about. And so what we're doing is, and we have done, is developing guidelines for families and friends on the safe delivery of food, and then supporting with promotional materials of older hours for grocery shopping. And while that's not ideal, and we would not certainly want older adults grocery shopping if they can avoid it, certainly having explicit hours that are separate from others is certainly better than everybody shopping at the same time. So, and then at the second level, we have our neighborhood organizations, of which there are hundreds. Many are doing, all are doing superb work, but some of them are smaller in capacity. And so we really want to organize that as much as possible. And we are working with different people at the city to try to think about how best to organize those efforts from the perspective of being sure that we can refer older adults who come to us into those efforts, and also make sure that those neighborhood organizations have guidelines for supporting food supply for older adults if that's not normally something that they do. And so, and then thinking about, well, for some of those organizations that are working at the neighborhood level, do they actually have the food supply they need? And if not, how can we help them find that? So that's our level 1 and 2 strategy. Next slide. For level 3, we start to look at the senior living facilities. These are the public facilities for low-income seniors. There are 145 where seniors are living in the city. Some of them are mixed facilities, but many aren't. And there are probably about 12,000 people or so living in these facilities. Many are already being served by incredibly well-organized groups. There are also a lot of senior living facilities that don't necessarily have an organized support network. And as our food supply and so forth is more compromised in the strategy, and as the number of cases increases in the city, we want to be making sure that seniors are staying at home. Our goal will be to reach between, in these facilities, around 8,800 residents. That would be through, these would be for mostly ambulatory residents who are living in these facilities, who are either already in programs that involve congregate housing, but that have now shifted into a home delivery model, or people who are not in the Eating Together in Baltimore congregate housing, of which there are about 115 residences. As Liz mentioned, those residences will be served by Salvation Army. Maryland Food Bank will continue to serve. The Baltimore market will continue to serve. And then, of course, we have the many organizations that Liz has already mentioned who are continuing to do their work, such as the Franciscan Centers. But what we want to make sure is that all of our senior facilities are covered, and not just those that happen to have really excellent organized neighbors near them. Next slide. And finally, level 4 for us is the most at-risk residents. These we estimate to be somewhere around 2,800 older adults who most need home door delivery. So this would be different than at a senior resident facility, where we might be bringing a large quantity of food to a senior facility and organizing a structured way of getting the meals to the individuals in their households. This is actually going door to door, which is what Meals on Wheels has always done. They're expanding their ability to do that in a massive way, with adding 100 clients a day. And that would be home delivered meals. And then when they reach that capacity, let's say we reach 2,800 individuals, we will look to our other emergency relief partners, such as Salvation Army, to hopefully step in. But this is, again, for people who are most at risk and who most need supports in this way. Next slide. The key to entry into these points of systems, there are many ways one can enter. You can enter through a neighborhood organization, enter through any of you all now that you know that this exists. But you can also enter through Liz's Maryland Access Point, which is in the Division of Aging and Care at the Health Department. It's a central point of entry, much like we have a central point of entry for infants and toddlers and pregnant women in the city. This is a central point of entry for older adults. For people for level 4, this just shows that if older adults are calling in, 85 and older, homebound, low income, or any adult who does not have any other available support and can't find their way to it, will be triaged into delivery services. Next slide, please. We'll be using a series of metrics to make sure that we're doing the work that we intend to do. Obviously, the most important outcome measure will be how did the city respond for seniors in terms of food security during the COVID crisis. But we're not there with our 2020 vision looking back and saying how things could have been corrected. So right now we have to do the best that we possibly can to make sure that whatever we're doing is being measured and helping to direct that our programs are doing the right thing. So some of those will be the number of calls to our MAP line and the percent of referrals, high-risk referrals, how many abandoned calls there are, where are calls coming from, how many home door deliveries we are doing, group-based deliveries, and then how many seniors are we serving with how many meals. And if you go to the next slide, it gives you a sense of the data dashboard that we look at every day. We're still working out kinks because we know calls come through 211, calls come through 311 for food related calls, and they should be forwarded into the MAP line. Maybe they are, maybe they aren't. So we're working with those partners to make sure that that is all in sync and aligned. But you can see that what we try to do is look at, if there are, we use heat maps to see where calls are coming from, to see if they're real vulnerable areas so that we can go and communicate back to neighborhood partners who are in those areas if we can't meet that need quickly enough. We use other tracking mechanisms of who's calling in, making sure that we're really reaching the people we want to be reaching. And then the proportion of calls by type and how many are abandoned. And I've walked you through those metrics, but just to let you know that we're working with an epidemiologist who's helping us track this over time and making this a pretty robust response from the point of view of monitoring and making sure our dollars are being used wisely. Next slide.
That's great.
There's also a mayor's office dashboard that our dashboard feeds into. And we have calls this week to hopefully streamline all of that so that people can see not just the older adults who are served, but the whole city and how food delivery is occurring. Next slide. And then finally, we have a communication campaign, Johns Hopkins Center for Communication Programs and others. I know AARP has been an amazing partner on this as well, is truly trying to get out this campaign that says lean on, which is let's make sure our older adults link to ways to get to foods and needs, explore services, ask for help, and not knowing that they don't have to do it alone. And this is the MAP line, the 410-396 CARE line. We hope to get this information out across the city. The most important thing is to be communicating this into the neighborhoods that at least hear the numbers and the messages that they need to hear for whatever reason. So we're really we've been speaking with some people in the faith-based community. We're expanding our messaging out as quickly as possible and hope that everyone listening in on this call will be able to share this number with people so that we can get people correctly triaged into the food supports they need if they don't already have them. Yeah. And I think that's the slides.
That's great. So maybe we'll just start, there was a question that came in before the call, and maybe we'll start with that, which was about our immigrant community and the role that sort of the health department's outreach. I see on this flyer, there's no little MIMA or CASA or anybody, and I just wondered, is there room to sort of reach out and partner with some groups like Esperanza or CASA, and if so, can we? Obviously, I represent a large number of immigrants in District 46, so certainly happy to help in any way with that. But just wanted to reach out and see what your thoughts are with outreach to the older immigrant community who doesn't speak English often.
Yes, all of our materials are being translated into Spanish. That's the one language we have confirmed translation for. This flyer should be done shortly. Absolutely, we should be reaching out into that community. One thing we haven't done that I'm realizing right now is that when we've done a whole mapping of all the senior residences in the city and looked at the number of units, but I don't actually know in those residents how many are residents that are catering to an immigrant population, number one, or even if they are, and if they aren't, we've got to be thinking about those residents. And so more discussion around how to reach would be very welcome, and absolutely they're part of the equation.
Great. That's wonderful.
Somebody asked, I just wanted to add that at Maryland Access Point, we have a fluent Spanish speaker, INR specialist, and all of the MAP specialists are going to be trained on the language line too.
Oh, great.
We also, I didn't mention that the Baltimore Neighbors Network that Zeke Cohen, Councilman Zeke Cohen's office sort of spearheaded with several of the mental health nonprofit organizations,
Yep.
are coordinating, I think, with CASA, excuse me, on reaching the immigrant population and addressing things like social isolation, anxiety, and loneliness.
And a
Yeah,
lot
no,
of our
Ross
stuff
is
is
doing
to Spanish.
great
A lot of our
delivery
stuff
work.
is in Spanish as well. Spanish
Oh,
and
great.
some Asian, you know, Chinese, Korean. So you have to
Right.
kind of, yeah.
That's great. So we had a question on the chat, which is there a place online where we can see the data dashboard you just shared?
So not currently, that's a great idea. We actually are making this, it's been inward facing to make sure that we're programming correctly. It isn't yet outward facing, and it probably should be. And to be honest, I mean, just because that is not even been discussed. So let me take that back. I think it's a great idea because then people can see what's going on. I think the mayor's office has their dashboard. Liz, correct me if I'm wrong. I think that dashboard is, at least parts of it are available, but I think we are all aligning our numbers right now, but for sure that's a direction we should be going in. So thanks for the suggestion, and we will definitely look to see how to make that happen. And I'll talk to our epidemiologist as well. Thank you.
Thank you. So what are your thoughts on, and this was a question that written in, but your thoughts on how people perhaps who aren't seniors, but you know, have a senior neighbor or know seniors in the community, how we can best be messengers or helpful to our neighbors and spreading sort of the word. Do you have any thoughts on best ways to do that?
And I know Liz will also have things to share here.
You probably all have ideas.
Yeah. I mean, from the health department side, getting the word out about the MAP line, I think, is critical. Most particularly to people who really have no other way of obtaining food, but to anybody, you know, allowing people to really know about that line. I think the opportunity that this disease presents, of which there's very few that one can see, and there's few silver linings, I guess, but one of them is helping people to become aware of resources that do exist in the city that maybe people didn't know about before. And the MAP line is actually really important because not only will it get people the food services they need, but it can also connect them into mental health supports and other kinds of supports that are needed. So I think, you know, really focusing on allowing people to understand the value of that line is one thing that would be very useful. I mean, the other thing that we're really trying to get our arms around is what are the most robust neighborhood organizations and how do we look at them as a network so that we can refer into those neighborhood organizations as much as possible and then provide the supports to them as they need them. Because you know, people are going to be most trusting of their neighbors, and so which neighborhood organizations are functioning in a way that can provide supports. The other thing is there are safety guidelines and food safety guidelines available on the health department website, and we can share those back with you all. Getting those out, making sure that neighborhood organizations and family and friends who are delivering food, making sure it's done in a safe way, particularly as the number of cases go up. This is going to be, you know, extraordinarily important. And so understanding the safety, and it's all pretty common sense. It's not like this is complex, but really ensuring that we're making sure that people understand the value of masks and gloves and everything else. Yeah.
Right, right. I'll note it gets cut off in this mayor's office dashboard map, but in Cherry Hill, Lakeland, or sort of also my district. So, but they tend to get cut off a lot maps of the city. And I know this is, you know, it's a small picture, but there are some great groups like the Greater Baybrook Alliance and, you know, Harbor West and others that are doing work reaching out to seniors down there. So I want to lift that up. And certainly I know there are groups in every district and around the city. So it'd be great to connect them with you. But Liz and Tammy, sorry, other thoughts on how to connect people or?
Yeah, well, I think the faith-based organizations that are in those neighborhoods too have a great idea of their parishioners' needs And I know many of them are also hosting food pantries and food distributions that have been key, particularly in that Cherry Hill area. I know that is a point of emphasis. I've always, when I ran my senior center, I often tried to target that neighborhood because I know it's a food desert and, you know, a population with, you know, higher needs and a lot of health inequities. Yeah, so, and also the senior centers, they know their memberships, you know, they're closed right now. So we have canvassed all the members that we've asked the senior center directors to score their members on their food security so that we can have them ready, and, you know, and the higher priority ones have already been processed to Meals on Wheels because they rely on that Eating Together program for their daily meal. Now that's taken away, and we, you know, we need to fill that need, that gap.
Yep.
Just a couple thoughts. And one of the programs that AARP at the national level created was that, and I mentioned it initially, was the AARP Community Connections. And they try to pair people who need things like groceries delivered, picking them up, or, you know, just facilitating that, lending emotional support to their neighbors, and it features helplines, volunteer support. But one thing that, you know, I've done a few of these calls with members of Congress. One of the things that, and someone mentioned it, is that Baltimore City has created through the Department of Recreation and Parks a virtual, it's at baltimorecity.gov/virtual, where you can access the Pratt Library online, Google virtual museums, the Walters Art Museum, Baltimore Museum of Art, Maryland Zoo, just things to keep people, because it's hard to spend the day, you know, in your house not doing anything. And so if people have access to a computer, they can do those virtual activities.
That is super helpful. Do other folks have questions? Feel free to put them in the chat. We had a few good questions. Or are there any other comments that folks would like to make? I don't want to be respectful of everybody's time, but this is really important and helpful information, I think. Make sure everybody knows how to reach all of you, and put your contact information up here. But I think this is great to know, really important for all of us to know how to support our seniors who are being disproportionately impacted and who come in, of course, with, you know, maybe being isolated, and this will only exacerbate that, so the situation. So really, really appreciate the work that AARP, the Maryland Philanthropy Network, and the Health Department is doing in this time, and how accessible you are and willing to think through new ideas. So thank you. Also, just want to, you know, turn it over to you for some final comments or any final thoughts that you might want to share with folks on today. Any final thoughts from, yep.
I just saw one question about what is an abandoned call.
Oh yeah, what is an abandoned call?
And I just wanted to say that that just means that if you call the MAP line and then you drop the call, you know, because you're not getting where you need to be getting into the queue.
Okay. Folks are asking how they're going to get a copy. We will be emailing out a copy, a link to we'll upload this onto YouTube and we'll send out a link, and we'll also send out the slides as a PDF. So we will make sure that everybody has this information because we want to spread the word about everything that's being done and how to get involved.
And Brooke,
yep.
I think you had some information on the Baltimore Community Foundation and the consortium that they have created for
to support
COVID
nonprofits
funding. Yeah. So if there are any listeners who, you know, especially the neighborhood associations, if they are a 501c3 or some kind of nonprofit, they can certainly apply for that funding.
That's great. Yep. We can send a link along to that as well. This is a sort of COVID response fund at the Baltimore Community Foundation that's available to nonprofits around the city to apply for work. So, which is really important because it's been hard. I've been working with a number of community development corporations and others to try to find funding And it has been tough. So I'm really glad that this has come online. It's really important. So
Yeah,
thank you.
particularly focused on the grassroots, you know, the boots on
Yep.
the ground type. Mhm.
Yep. Absolutely. And Beth notes that Care First is requesting proposals for funding with an emphasis on serving seniors. So that's great to know as well. Thank you, Beth. Well,
I
great.
just have just one
comment?
more, just
Yeah.
final comment. If you,
Yeah.
you know, just stay, I think being connected to your neighbors and understanding your neighbors and making sure that they have the resources they need. If they can share all of the things that we've shared today, if they can check in on their neighbors. I even, you know, there is that senior call-in check-in through the Department of Aging. And I think, I don't know if Rebecca or Liz mentioned it, but you know, that's where your neighbors can get that call to make sure that they're okay. So just making sure that they look at the resources that are out there. ARP is proud to be a partner with some of the food programs in Baltimore City and around the state. So if you need us, you know, and there's need out there, just let me know and we'll try to see what we can do.
That's great. Thank you. Thanks all of you so much for joining. Any final words, Liz or Rebecca? Any final things you'd like to share? No? Good. Okay. Well, thanks so much to everybody who joined today. And a huge, I always like to end with a note of gratitude. You know, we have the privilege of being at our desks right now, and not everybody does. So a huge thank you to all those essential workers out there, our transit drivers, our cafeteria servers who are serving our kids meals every day, folks who are working with our senior community members and all our public health teams. So thank you, church leaders, to everybody who's out on the front lines doing that work. It's so important, and I am so personally grateful for all that you're doing. Keep in touch, take care, and hope to see you on Wednesday when we'll be speaking with Attorney General Brian Frosch about price gouging, about scams, and about hate crimes in the Asian community, which has been unfortunate to see. So please join us on Wednesday at 2 p.m. and I look forward to seeing you all soon. Thank you so much, everyone. Take care.